The House Oversight Subcommittee on Public Health and Food Security will come to order. Would the clerk please take the attendance?
Chair Beerline.
Here.
Representatives Paquette. Here. Green. McDonald. Here. Cerniglu.
Here.
Mr. Chair, you have a quorum.
Will the clerk please read in the letter from Oversight Committee Chair Jay DeBoyer?
And a letter dated September 12, 2025. Dear Mr. Clerk, I appoint the following members of the 103rd Legislature to serve as alternate members of the following oversight subcommittees: Public Health and Food Security, Representatives Alicia St. Germain, Karen Whitsett. Sincerely, Jay DeBoyer, State Representative, District 63.
Representative Paquette moves to approve the minutes from the August 19th meeting. Hearing no objection, they are approved. Representative Cerniglu moves to approve the minutes from the August 26th meeting. Hearing no objection, they are approved. Today we'll be taking a closer look at the implementation of Michigan's Filter First law, which requires schools and child care centers to install certified filters at drinking water outlets to help protect children from lead exposure. We'll be hearing from a variety of perspectives, including representatives from schools, a child care center, and a licensed plumber who are directly involved in meeting these requirements. I appreciate each of our speakers for taking the time to share their experiences, challenges, and suggestions with the committee today. My office did reach out to both Eagle and MyLeap to invite them to testify today. Unfortunately, neither department was able to send a representative. However, we do hope to hear from them in the future, whether that is in this committee room or through their responses to the information that we hear today. Our goal is to gain a clear picture of how implementation is going on the ground, what's working well, where challenges exist, and what adjustments might help ensure this program achieves its intended purpose. As always, our focus is on accountability, transparency, and improving outcomes for Michigan families. With that, again, I thank everyone for being here, and we'll begin by inviting our first testifier to the table. Please welcome Steve Clark, the Superintendent of Vassar Public Schools. So Steve, whenever you're ready, have a seat, push the red button, and the microphone will be yours.
Good morning, Chairman Beerline and members of the subcommittee. My name is Steve Clark, and I am proud to serve as the Superintendent of Vassar Public Schools, a district of about 750 students in Tuscola County. Thank you for the opportunity to share our experience with the implementation of the Filter First law. Let me start by saying that I fully support the intent of this legislation. Every child deserves access to safe drinking water. As a superintendent and as a taxpayer, I value the health and safety of our students and community above all else. The intent behind this law, to protect Michigan's children from lead exposure, is unquestionably the right one. That said, as with many well-intentioned laws, the reality of implementation has revealed some unintended challenges that I believe are important for you to understand if the goal is to strengthen the policy moving forward. One, a disconnect between intent and impact. While the law's purpose is admirable, its focus is too narrow. Children consume most of their daily water at home and in the community, not only in schools or child care centers. By targeting only educational settings, the law gives the appearance of comprehensive protection, but doesn't meaningfully reduce children's total exposure risk. If we truly want to protect public health, we have to address the broader water infrastructure, treatment, distribution, and aging service lines, not just the last few feet of plumbing inside our schools. Filter First doesn't get us there. Two, implementation barriers. Our district received a $46,000 grant through the Healthy Schools Grant 12A to help comply with the law. We are using that funding to retrofit hallway drinking fountains and food preparation sinks. However, the grant did not cover classroom sinks or other locations where students might fill water bottles or cups. More frustratingly, the Filter First grant prohibited the use of inline or entry point filtration systems, options that would have been far more practical and cost-effective. We were forced into a piecemeal approach when a single building-wide filtration system could have protected every fixture at a fraction of the cost. Three, financial and staffing burden. Once installed, the financial responsibility shifts entirely to districts. The cost of replacement filters is significant, and the maintenance workload adds up quickly. For a small district like ours, this means spending both time and money that could otherwise go toward teaching and learning. This is not a matter of unwillingness. It's simply unsustainable for local schools to absorb these recurring costs year after year without dedicated funding. 4, testing results and ongoing compliance. Recently, our district did a full-scale test through DHHS on all of our faucets in 3 buildings, 110 faucets in total. The collection and processing of this testing was very time-consuming, taking well over 3 hours to collect the samples. The ongoing cycle of testing, documentation, replacement, and reporting has created a new layer of operational complexity. Unfortunately, the communication and guidance from Eagle have not always been clear or consistent, which only adds to the frustration and uncertainty at the local level. 5, recommendations for improvement. I offer a few recommendations that I believe would make this law both more effective and more manageable for districts. Allow inline and entry point filtration systems as eligible uses of grant funds. Provide sustainable funding for long-term filter replacement and maintenance. Adopt a broader public health strategy that includes investment in water infrastructure beyond school properties. In closing, I want to thank the committee again for the opportunity to testify. I genuinely appreciate the legislators' focus on children's health and safety. Filter First was created with good intentions, but to fulfill that promise, it must be practical, flexible, and sustainable. With clear guidance, adequate funding, and a broader public health lens, Michigan can lead the nation in protecting children from lead exposure, not just in schools, but in every place they live, learn, and grow. Thank you for your time and your commitment to Michigan's children.
Thank you, Steve. What kind of communication have you had during this process, either prior to or after receiving a grant from Eagle?
Primarily, it's been through like newsletters, emails, that kind of thing. I've had no personal contact.
Has that created any barriers in your installation process? I mean, if you've had questions come up, have they been responsive?
Leads to a lot of us trying to decipher intent or meaning for particular requirements. I think I did try to get on a webinar at one point, and it was inaccessible. So yeah, it's just a lot of us guesswork, essentially.
How much of your installation have your grant funds covered, if you're aware?
We're just beginning that process. We have reached out to all 5 manufacturers that were approved through Eagle, and we only received responses from 2 of those, multiple providers, but two producers, so LK and the Morris Group. Morris Group was interesting because they did not offer faucet filters, only water bottle fillers.
Is there any other questions from the committee? Okay, thank you, sir, for your time. I appreciate you coming down. Next, through Zoom, we will have Eric Hopstock. Eric is the superintendent of the Berrien County RESA. He covers Cass, Van Buren, and Berrien counties. Whenever you're ready, sir.
Thank you for having us. Thank you for also being flexible, chair and representatives, to allow us to meet with you via Zoom. It is greatly appreciated. Yeah, we agree that the intent of safe drinking water is an admirable one, but it has resulted in some implementation barriers, funding barriers, and then communication. Particularly in the communication, it is the ever-changing nature of the communication. Guidance that we get maybe months ago, it changes, and then that requires a rethink. I have brought with me today Troy Boone. He's our Director of Facilities and Security here at Berrien RESA, to talk about the implement. His voice really represents monthly meetings he has with facility directors throughout our county, Van Buren and Cass County. So when you hear his comments, they're really reflective of 30 school districts within this southwest area. So Troy.
Yeah, thank you for having me. I'm Troy Boone with Berrien RESA. You're going to hear a lot of redundancy from me based on the superintendent from Vassar schools. Implementation wise, the initial grant covers startup costs only. No funding exists for ongoing labor and materials. Moving forward, the process outlined by Eagle is very labor intensive. Each building requires us, and we're relatively small, about 15 to 25 staff hours per sampling cycle. Each school must certify compliance by the end of 2025-26 school year, which Eagle has not yet determined what that compliance looked like. They're telling us that we have to justify that we're following all of the Filter First guidelines, but there's no guidance on how to actually get that information to them. For our district, this workload could exceed the available manpower quickly. And we're going to exhaust all efforts relatively fast, just trying to comply and do our sampling cycles. The frequency of the filter replacement is still unknown for us, making planning for future replacements very difficult. When it comes to the funding side, Filter First, they're going to reimburse us for filtered bottle filling stations, faucet mounted filters, filtered pitchers for daycares, and also replacement cartridges. Inline filtered costs are excluded for reimbursement, which we have to have those just based on how our plumbing layouts are in our facilities. And it also talks about retrofitting bottle fill stations, but anything that's prior to 2014, Eagle doesn't give us any guidance on if we can install new bottle filters on those existing water coolers or not. But at Berry and Risa, what we're doing is to protect our general fund. We are holding off doing any kind of implementation or any kind of installation until the beginning of next year. We're hoping that more funding will become available for inline bottle fill stations, which that's going to be the bulk of what we install in our facilities. The Eagle guidance is highly detailed and continues to cause confusion around fixture classifications, approved filters, notification requirements. Like schools are supposed to notify families and staff of testing results, yet no standard process or templates have been provided. Clear, simplified communication guidance would help to ensure consistent messaging statewide before the July 1st, 2026 deadline. Eagle's signage guidance has changed repeatedly. Initially allowed one sign per group of non-potable filters. Later, Eagle came out and said individual signs for every fixture for non-potable fixtures. And now we're back to group signage again. So just some clarification from Eagle on how we need to identify potable versus non-potable water would be helpful.
So thank you for the opportunity to give our experiences. Like I said, these are reflective of many of the districts within our areas. So if you have any questions, we'd entertain these now.
Representative Green.
Did your water test positive for lead?
No, our water does not test positive for lead.
Okay. That's okay. But you have to put a lead filter according to the law on your stuff. On your
Yes, that's correct.
So I have a migraine, so I'm trying to navigate through this. Okay, there's a reason, I guess. Okay.
So you're going through this with 30 different school buildings or 30 different districts?
30 different districts. So we're talking 150 buildings.
And each building will have to meet these requirements to, despite whether or not they have lead in their water, as Rep. Green mentioned.
Correct.
So are you aware yet of what the funding gap is between what is being provided by the state in grant funds and what the school districts will have to make up to finish installation?
Well, the funding gap really is circled around that 2014 fixture date. So anything prior to 2014, you can't install a filter on it per Eagle's guidelines. You have to upgrade all of your fixtures downstream in order to use that inline filter. So anything after 2014, you can install that inline filter, which they have accepted that as an approved filter, but they will not provide funding for an inline filter.
Some of the difficulties in answering your question is because of the inconsistent guidance we're getting from Eagle. And because of that, the number's going to fluctuate because we don't know what is acceptable and what is not.
Representative McDonald.
Thank you, Chair. Actually, I just wanted to ask for some clarification. My staffer told me he heard from someone that what we're talking about is there used to be a, there used to be a test and chase program, but that cost more, is that correct, than what we're doing now? And that this is supposed to be a way to make it more efficient, but it's just not working? Or what is the basic issue?
We're talking about a legislation that was passed last term that said every school district, any potable water has to be filtered specifically for lead, whether there was ever lead in the system or not. And it's not just school districts, it's also daycare centers, both private and, well, I guess they're all private.
Okay,
So I don't know
And
about
it's-
the previous test and chase method.
okay. But this is, obviously I can hear that this is not going very well. Thank you.
What information specifically do you feel like you're currently missing from Eagle moving forward so that you can meet the requirements? 'Cause these are things that we can
Well, we would
request and try to get
actually-
answers to.
We would actually hope that they would clarify filter compliance, and if it's an acceptable filter. I don't know if that's through a submittal process, but that's something that would help us decide if these apparatuses are what we could use to comply with Eagle. The other thing is just straight communication. I mean, it's just been back and forth on, like, just how do you label your fixtures? If we have to do every single fixture in every single building, that's going to take an ungodly amount of manpower. Granted, that's only one time that you have to do that at the beginning, but then all the bottle sampling and everything that you have to do and get it third-party tested. I don't understand why we have to do third-party testing if we could do that internally. That's another thing that's going to cost every district moving forward a lot of money outside of the initial. And then, we have to be certified by, we gotta show certification by July 1st of 2026, but there's no guidance on what does that look like? What do you need from us? What do we need to show you that we're following the Filter First guidelines, which we're really not 100% sure on what we're doing?
Any other questions? Thank you, gentlemen. Appreciate it.
Thank you.
Next on Zoom, we have Jim Ply. Jim is a former principal and the current Facilities Special Projects Coordinator for Montrose Community Schools. He's been helping his district manage initiatives like Filter First, and we appreciate his time this morning.
Thank you, and thank you for the invitation. I'm just going to throw numbers at you. It's pretty much what we're going to do. We have not been fortunate enough to get a grant yet. We're in the current cycle with the Healthy Hydration Grant, and hopefully we will get that. Otherwise, the cost of all this is going to fall directly on us. We're fortunate enough. Montrose is a small school district in northern Genesee County, serving about 1,400 students. I will agree with everyone else when I say that the idea of clean, safe drinking water is extremely important. Again, not just at school, but everywhere. In order for us to comply with the minimum requirements of the law, we're going to have to install 6 new fountains throughout our 3 buildings. That's going to cost us approximately $24,000 in the cost of the units and in hiring a plumber to come in and do this for us. The other issue that we're going to have is we really need about 18 inline filtration systems because we need to filter the water in our several areas within our kitchens in each of our buildings. Also our teachers' lounges because they pull water out of the sinks to make coffee with, and those by law now have to be filtered as well. And then the real problem we're dealing with is all of our early elementary pre-K programs have drinking fountains within their classrooms because it's extremely disruptive to pick 15, 20 kids and we're going to march out and we're all going to get in line at the drinking fountain and we're all going to get a drink, whether you need one or not, and then we're all going to march back in. So in the design of those rooms, drinking fountains were put in those rooms to make it more convenient for those kids and those teachers. We're going to have to see if we can put inline filters in there if they qualify. If not, then we'll have to come up with another solution for those early L classrooms. Altogether, we're looking at just to meet the compliance about $32,000 that we're going to have to come up with out of our general budget. And again, if we are lucky enough to get the grant, I believe the grant's only going to cover about 18,000 of it. And that does not include, as has been brought up, the manpower and cost of testing that's going to have to happen in our buildings throughout the course of a year. Also, the cost of replacement filters, which are not cheap. We're looking at, for our drinking fountains, it's probably estimated at about $4,200. We're going to have to spend yearly on filter cartridges. And if we are able to put in inline filters, that's another $1,000 for inline filters. So the cost is a bit prohibitive, especially if we do not get the grant. But beyond that, it's also the burden it's going to put on our maintenance folks. We only have two. So the burden it's going to put on those two guys to do the sampling, to do the flushing of the lines, to meet the requirements of the law. It's again, a great idea because safe, healthy drinking water is important. We already had that because our testing results have not come back with any issues with lead or other particulates in our water. But we're still going to have to meet the law, even though we haven't had a problem.
Jim, when you guys have done that testing in the past, do you test it when it comes into the building? Do you test it at individual drinking fountain sources? How does that work?
So in the past, what we've done is we've tested at source. So we'll go to drinking fountains and pull tests randomly from different buildings, from different fountains. We've never tested them all at one time, which is what will have to happen here. So we'll see.
Have you just to recap, you've currently applied for a grant and you're waiting to see if it's being awarded?
Yeah, so the second version of the Healthy Hydration Grant came out this fall. We have applied for that. From what I understand, we should know by December if we have qualified or not.
And then do you guys meet as like an ISD and kind of talk as superintendents and principals? Is this a reoccurring theme in the schools in Genesee County?
Yeah, so our maintenance directors get together every other month, and this is a large topic that consumes a lot of time from everyone, and everyone is very confused on what it's going to take to fulfill this. And again, I think has been brought up by the Berrien County superintendent. How do we report it? I think my favorite issue with this is when I contacted Eagle back a year ago to say that we have completed our study, we've put together our plan as directed by the law, and where would you like me to submit this to? And their response was, well, you don't submit it, you just, make sure it's available in case anybody wants it. So ours is available.
And to clarify, you've never had any sort of negative test in your water system for lead?
We have in the past, yeah.
You have. And how did you address those when you had them?
In the past, we would bring in an independent third party and just ask them to, we did some testing both of water and of air quality in the buildings. And that's how we would do it. We just contract a third party.
Thank you very much for your time. No further questions? Oh, no, Representative Green.
Okay, so do you have your own well? Is that,
No,
okay.
we're on city water.
So you, okay, so Montrose has municipal water that is
Correct.
pumped to your building.
Correct.
Does Montrose conduct, I know they do, so you don't have to answer this. Montrose does conduct regular testing. Have they ever tested from coming into the buildings?
All of our testing has been at the actual water source, so drinking fountains.
So when you did test positive for lead, was the rest of the municipality testing positive for lead too?
We have not tested positive for lead.
Oh, I thought that's what, I'm sorry, maybe I misunderstood.
Yeah.
Oh, you've tested for it previously and it was always negative?
Correct.
Okay, and same with the municipal drinking source as well?
Yeah, Montrose's drinking water is tested
Okay,
fine every time I've seen the reports.
okay. That's, I remember this bill being passed, but I'm just trying to wrap my brain around, because then, I guess, and this is not necessarily directed to you, but do we have any water experts coming? Because like, at some point, they're pulling everything good out of the water too.
We do not today. We were hoping to have both Eagle and Miley. They weren't able today. We're hoping to get them either in the committee in the future or just to have them respond to
Okay.
committee. I just want to verify. So you believe that your filter replacement is going to be about $4,200 a year, which, I mean, in the scheme of things, it doesn't seem like a lot of money to make sure that kids are getting safe drinking water, except they're already getting safe drinking water. So it's just additional cost to the school district that I'm sure you're not, sitting on piles of cash.
Yeah, so we're anticipating $4,200 a year just for the drinking fountains in the hallways. If we put in the inline units, then it will go up from there.
Okay. Thank you very much, Jim. We appreciate your time today.
Thank you.
Next, I would like to welcome Steve Schreiner with Schreiner Mechanical out of Frankenmuth, Michigan. Steve and his team have been an important part of helping schools and child care centers in our district meet the Filter First requirements. His company has worked hands-on with local facilities to install and maintain their filtration systems. So Steve, we appreciate you taking the time today to share your perspective as a licensed plumber and contractor who's been directly involved in this process.
Thank you. I believe it takes a lot of energy to make this happen today, and I really want to commend you for doing this. I think persistence by us, you're listening, and maybe not agreeing, but listening brings this together. And yes, safe drinking water is something that I've worked with for over 40 years. I'm a master plumber, mechanical contractor, and a boiler contractor. I've done a lot of work in schools, churches, houses. We have to follow laws. We're under the guidance of the state of Michigan with the Bureau of Plumbing, Mechanical, Boiler Codes, cross-connection. I'm a cross-connection licensed contractor for many years. I gave that up 2 years ago when the lawsuits all became very in front of me with the Genesee County program, and cross-connection is a big program, but I was a licensed cross-connection contractor for many years and still follow and still work in that profession helping. Safe Water 2014, it was very clear all water faucets had to be lead-free by a certain content. No lead was allowed in these faucets, and if there was, it was a very minute amount. We used to, as plumbers back in years ago, we used to use something called solder, 50-50 solder. which had lead content in it. We are no longer allowed to use that. Since then, PEX pipe, different types of copper, silver solder, different ways of putting things together to create safe water. Water heaters from manufacturers, whether it's A.O. Smith or whatever manufacturers out there, even Bradford White out of Michigan, they all use what they call glass lining. Why is that? To keep your water safe. NSF approved. So I follow these laws, and I have followed these laws for many, many years, along with every other plumber. When the plumbing inspector comes in, most times if you're in a school, you're asked to flush the water and test. So I've been through this for many years. My dad, my grandfather, this is not anything new to our family. I was sick. I had West Nile for 14 years. I suffered with water, suffered with my own water at home, and I had it tested. So yes, I do understand water very well when it comes to contaminants. When it comes to arsenics, and when it comes to all the other stuff that's in the water, in your aquifers that's coming up and you're drinking it, it's amazing what's in that water that you're allowing your children and or family to drink or use. Now we're talking about schools, talking about daycares. In Frankenmuth, Michigan, our water is the lowest lead level that it's been in the history of our water. City of Frankenmuth normally had to test every year for lead content in their water. They've now been told by Eagle they do not have to test every year, it's every 3 years. Wow, that's pretty neat. But I've been involved with this program since the crisis down in Genesee County. And I've been watching, been listening, and then here comes this program. And I thought right away, told my guys, this isn't good. It's going to be unsafe. It's not going to be under control. It's going to be out of control. The money is going to be filtering out, going to places where it doesn't belong, and we're not protecting the schools that need to be protected. As in Frankenmuth, we've done a lot of work with them schools. I know the people that have done work in those schools if it wasn't myself from our company, and I know the state inspectors that did the inspecting. I know that it was safe. I know that they did their job. So my question is always, why can't I do a ground study before I do anything to find out, do I have or do I not have lead in my system? We know coming from the city of Frankenmuth or from any municipality, what is the content of that? What's in the content of that water? So with that being said, there is no reason why I should not be able to, as a plumber and or as a facility operator, have water testing done in my own facility. Whether it's my house, whether it's my church, or whether it's my school, whether it's my daycare. And I can send that water to a facility that is approved for lead testing. There's several in the state. I approached to have this happen last week. I did my due diligence, got a hold of the lab. I drove down to the lab, which was an hour from the shop. Told the gentleman what I was doing. I picked up multiple sample bottles. He gave me directions. The next morning, after 8 hours of non-movement of water, we did our sampling. Or I'm sorry, we picked them up on a Friday, and Monday morning I took them, no, I'm sorry, it was Friday. Took them back down, had one of my guys drive down with the samples with a check. He come back to the shop and told me that I was gonna get a phone call, with a phone call being from the testing lab that they will not test the water. They feel uncomfortable. They didn't like the paperwork. They don't want to be in the middle of a mess, were the exact words that were spoken by the testing lab that I took the water samples to. I thought, wow, I'm being slapped in the face. All I want to do is check St. Lawrence Lutheran School for lead. And I had talked to the administration of the school, and I was granted that permission to do so. Actually, the testing, the samples were taken by the administration and by the facility manager for the water. But again, they refused to do the testing because on grounds they didn't want to be in the middle of a mess. So I took it upon myself to get another testing lab from another area, Western Michigan. Told them exactly what I was doing, and again, this lady said, well, not again, but this lady said, we will absolutely do this. Not a problem. What I find interesting is the differences in the way that the testing is to be performed. The first one, I just get bottles, I fill them up, I take them back down, and in 24 to 48 hours, I have results. The second one, they sent me a cooler, igloo cooler, with the bottles in it, and said the water is to be collected and how I'm supposed to do it, how I'm supposed to label the bottles, and it would be between 5 to 7 days for results. That's how long it takes for them to get results from the water. I thought that was odd. Why would one be 24 to 48 hours and why be the next one be 5 to 7 days? So with that being said, I find that aggravating as a plumber. And as a contractor, a business person, a taxpayer, as a person that's just trying to do his due diligence of finding out the absolute truth about our school and whether or not it has any lead content at all. And if it did have lead content in it, then correct it. Find out where it's coming from and correct the problem. I've been asked by several school districts for filters. How much are they? Where do I put them? I had 3 walkthroughs in schools with manufacturers. The manufacturer, first round, would tell us what we had to do. We had to put a filter on the hot. We had to put a filter on the cold. We looked at the early development center, and underneath those sinks, it would be very difficult to apply these filters. Then it changed to only the cold. Then it changed again to you can't run that through that faucet, you got to put a separate faucet in. Then you have to put signage up. Each and every time that we did this, all I found was a complete different story from the previous trip that we had through the school. There was an absolute direct phone call that came from Eagle to the gentleman that was taking us through, the manufacturer, as we were in the kitchen at St. Lawrence Lutheran School. I said, what about the ice maker? They were putting in a new large ice maker. And it was an exact program of how do I filter that? You don't need to filter the ice maker. That's not in the program. That threw my flag up. I, as a plumber, am looking at this saying, how can you not have to put a filter on an ice maker, but you're putting it on everything else? Then also a refrigerator in a classroom that has ice and water through the door does not need to be filtered. That's not in the program. It's not part of the program. How is that exempt? Who made this list? I have to follow laws as a plumber in the state of Michigan. There is no such thing as exempt from this and exempt from that. I am not allowed to put in a faucet that has lead content. I don't know of any faucets that have lead contents, if you want to know the truth. I have gone to Kohler. I've talked to the owners. I've talked to their platform engineers. I've gone to Delta. I've gone to American Standard, and I've gone to Moen. All faucet manufacturers have had the exact same comment. Who said we have lead in our product? It wasn't me. I didn't say it. But I know since 2014 what we've done as plumbers. And even before that, safe plumbing practices always continued. So my feeling is that water needs to be tested prior to. And if there is lead present in a program, we need to address that in a proper way. We don't put a filter in that went from $20 to $100 in a matter of 1 year. We don't put a filter in that's going to be changed by somebody that may not be qualified. Or we may not change it at all because of the cost of the filter. We just completely disembark, we straight line it. Who's going to look at that? Nobody. One other item that was brought to me very clearly at the beginning of this program is that all these devices that are going to be installed in these schools and or applications are going to have to be done under permit by a state licensed plumbing outfit program. And there's not enough plumbers in the state of Michigan, I don't think, that could do this, number one. Number two, I do know that most facilities are doing this on their own, which I have no problem with, but there are no permits being pulled for these apparatuses that are being installed, which the plumbing department clearly stated that they are going to require a permit for each and every device that's being installed. Thank you. I don't know if I'm helping, hurting, or what I'm doing for this, but as a plumber, my heart's in this. I have grandkids, I've got kids, and yes, I want safe drinking water.
Thank you, Steve. I'm going to start with the first question, then I know Rep. Green has some, or at least one. So you've been a contractor for a while, not to say how old you are, but you've been doing this a while. Are change orders something that you like to get as a contractor?
Change orders are normal.
Okay.
That's
Do they-
part of our business.
Do they drive up costs typically if you have to go back and change what you've already done? Or at
Yes.
least change what you've planned for? So is the lack of communication from Eagle and the lack of clear guidance been a problem?
Shriner Mechanical has there's no communication between Eagle and Plumbing Houses. I'm also on the Plumbing Inspectors Association. I'm involved with that, I'm a member. And that is one thing that has been brought up at our association meeting, that there is no communication between Eagle and the plumbers or the inspectors. This is, from my understanding, this has been between the schools, building owners, and those folks. It's not something that's coming to us. We can look it up, yes, but that's what we have to do. We have to go after it. It's not coming to us.
Representative Green?
Thank you, Chair. Okay, I want to go back to the ice machine because I'm still trying to wrap my brain around that. So the ice machine, which ice goes into our beverages, that does not have to have a filter.
Ice machines are not in the program, as I was told, so no, you do not have to filter an ice machine.
So there could potentially be lead coming from the water to the ice machine, and then they have lead in the ice? Is that
That would be a correct statement.
okay? I'm trying to wrap my brain around all of this, and it's really hard.
You can't.
Okay. So another question, you were talking about the source, and I just want to put this out there because a little fun fact, the headwaters of the Flint River is a Superfund site, pouring and leaching chemicals in it, but nobody seems to care about that. But then they keep wanting to put filters on every single faucet possible. So they're not even, because you talked about the source, like where water comes from in the ground, where water comes from in the plant, and usually that's clean. And obviously we've had the whole Flint crisis, and that's because of the switching of the pipes and the sources of it. But just fun fact that the Metamora Superfund site is leaching into the Flint water system, which nobody seems to care about. And I'm glad we're caring finally about water for children, but I think if we're really going to care about water, we need to start paying attention to what's going on in the state, because I know Metamora is not alone in that. So that's just a little fun fact.
Do you anticipate that once installation is complete, will school maintenance staff be able to maintain these systems? Is it going to take plumbing contractor? Is it going to take some specialized training? Just in your years of experience.
Manufacturers that build these, they put their filters on there, and these filters have to be put in a specific way. They're just not something that you throw in. So the person that is doing this, yes, has to be somewhat qualified, gone through training so they understand how the filter is going to be taken out, properly disposed of, and then also a new filter being put in. Yes, absolutely. Facility management most likely will be putting these in, but I do not believe that the training to the facility management is going to be there enough, because the changes that I've seen in the way that manufacturers build and how they do things, they change every year. So this is going to be a yearly program that these folks are going to have to go through, which is going to have to be paid for, put on. And I'm sorry, but I'm not one that's going to sit in front of a computer for 2 hours listening to some guy tell me how to change a filter. It needs to be done in person to show people. It has to be a hands-on. That's the only way this can be done and done correctly. Again, these filters, when they're taken off and put back on, or filters are being changed, nobody's talking about what's going to happen to those filters that they're taking off and/or the cartridges that they are taking off to put the new filter in, cross-contamination between the old filter and the cartridge they're putting the filter back in. There's going to be some issues that are going to come on down the road with that.
Then I think I just have one more question for you, Steve. So over the course of your career, I'm sure this isn't the first time that you've installed a filter on a water system anywhere. Have those changed much over the years? The filter systems, have they advanced? Has new technology come out and somebody deems that what was previously the proper filter system is no longer adequate to do the job that we hoped it would do?
Absolutely. I, at my own residence, I put in a full reverse osmosis program for my house because my water was so tainted coming from the aquifer that it was deemed as unusable water, even though I have neighbors living right next to me, and I took the results of those tests to the county health department where I live. And they just shrugged their shoulders. There isn't nothing we can do. But what you're saying as far as our changes, yes. Every year these changes are being made to create more difficulty for people to understand how these things work. It becomes, for me as a plumber, it gets really difficult for me. So I can only imagine, I've been doing this for a long time, how can a guy or a person that, you know, he just got hired in as a facilities manager or hired in as doing this type of work, you know, in the facility, how can he comprehend how this stuff goes together? And then the following year, the changes have been made. Oh, now instead of doing that, you got to do this. And it's just gonna, it's gonna get muddied. So yes, that's true.
Representative Green?
Well, just for clarification, so what you just stated was that the process of putting and installing the filters are changing the regulations from the government, but I guess for clarification, a reverse osmosis system hasn't changed in technology though, has it?
No, the filtration of the water before it gets to the RO system has. So the way you're taking iron out, how you're taking and running the water through maybe softeners or products before it gets to the RO, so the RO will last longer. So you do pre-filtering before you get to the RO, yes.
But that, I mean, technology-wise, how much has that changed in the last 20 years?
Quite a bit.
Oh, really?
Yes,
Okay.
quite a bit. The type of beads that are being used for the iron filters, things of that nature. And also companies, manufacturers are also recognizing all the chemical and all the stuff that's in the water. So they're trying to advance what they're doing to help take that out. I want to mention one more thing. I have a school district that's close by. They put new water filtration program in, and this is in the Millington district. He said I can mention this, so I'm going to mention it. They put their own water bottle filling stations in. These filters are supposed to last approximately a year. They are not into their first quarter of the year, and the filters are already blinking, and they got to change them. Millington's on well water. Their water's not as clean. The TDS is higher. So guess what happens to the filters? And he was asking me for pricing on filters, and I've made that accommodation. My cost on that filter is $86 a piece. And I would believe that I would say within a year, you're going to see those filters probably at 114 to 115 once this gets rolling.
So a district like Millington then would benefit from a pre-filter or a whole system, well water, like filtration system then to get to those end ones. But then you used another example, like, or is it Frankenmuth or Montrose, or I'm starting to lose track of the school districts, but their water's already clean, so their filters will last long. So there is then a disparity between the districts depending on their source of water.
As a plumbing contractor, I feel that every school before it opens, the water should be tested, period. It should be tested at the beginning, and it should be tested at different locations within the school. No filter is going to stop the lead. We need to stop the lead if the lead is there. But if there's no lead, why are we spending all this money on projects that don't make no sense? $85 million high school was built in Saginaw, Michigan. It's brand new. It opened up in 2025. They have to follow under the same program as what we are following. That was under state guidance through the whole program. Why would that school have to follow through the same program if there's no lead coming in and everything that was put into that school is up to code by the state of Michigan, approved for occupancy?
And I guess the comment would be is then, so like a district like Millington, that's already a smaller district, is going to need more funds than a school like the brand new Saginaw school, but there aren't going to be enough funds to then comply according to our grant system. Then is what it seems like.
Again, would you want to know first with Millington, do I have lead in the water? If I have no lead in the water, why am I putting these filters in? That would be first. Let's do our groundwork. Let's make sure we're clean before we go to the next step.
Steve, thank you very much for your time and your experience. Next, we have Kimberly Zender. Kimberly is the owner and operator of EduPlay Discovery Center. Kimberly has been a strong advocate for early childhood education and has taken an active role in navigating the Filter First requirement at her center. As both an administrator and educator, she brings valuable insight into how these new regulations are impacting childcare providers, from the application process for grants to the installation and maintenance of filtered water systems. So Kimberly, we appreciate your time and expertise, and if you'd go ahead and get started whenever you're ready.
Thank you. Good afternoon, Chair Bierlein and members of the subcommittee. I appreciate you allowing me to sit here and share this information with you. My name is Kimberly Zender. I am the owner and operator of EduPlay Discovery Centers in Frankenmuth and also Saginaw. Childcare and preschool programs that serve about 130 wonderful children every day, from tiny little infants just learning to crawl to excited little preschoolers who are asking 100 questions during lunchtime. I'm also a lifelong Michigander, a mom, a small business owner who has spent the last 13 years making sure that we're in a place that parents can trust, a place that's safe, clean, and also joyful. Let me begin by saying that I completely support the goal of ensuring safe, lead-free drinking water, especially for our most vulnerable population in Michigan schools, childcare, and preschools. No one disputes that clean water is an essential to children's health and development. The intent of the Filter First requirements, wanting to protect kids from harmful exposure, is very admirable. But the reality of this bill, as written, would create serious unintended consequences for childcare providers like mine, for local schools, and for the very families that this bill aims to protect. Although from a childcare standpoint, as of October 24th, childcares were already underneath the umbrella of having to have their water tested their water tested and also having the water management plan in place. The first issue is the cost of funding gap. At EduPlay, we operate on a very razor-thin margin, as do the majority of childcare centers and preschools. Every dollar is carefully budgeted between staff pay, food, curriculum materials, and also facility maintenance. The high costs and ongoing expenses and inadequate budgeting. So the cost does not end with the installation. Districts and schools must also pay for the recurring testing and ongoing filter replacement, creating a perpetual financial strain on budgets that are already stretched thin. And again, this is in the childcare arena. However, as you've heard from the people that have come previous to me, it's as well in the schools with the budgets. We've already looked at what that might mean. So several $1,000s up front, hundreds more each year to maintain compliance. There's no stable state funding to be able to support that requirement. The grants available today are limited, they're inconsistent, they don't cover all centers. In a small community like Frankenmuth, that means tuition increases, program cuts, neither of which families can afford in any community. They're working parents, teachers, nurses, small business owners already stretched thin by inflation and childcare costs. So the next issue is pretty redundant and unnecessary for many centers. EduPlay's water comes from Saginaw County, which exceeds its testing requirements. Our building is new. We opened in 2018 and everything was built from the ground up. Our plumbing is modern. Our testing is already part of our licensing and environmental health requirements. Yet under this law, we'd be treated exactly as the same as an older school building with century-old pipes. This one-size-fits-all approach doesn't make any distinction between facilities that are already compliant and those that genuinely need remediation. The funding and money is best used in areas that need it. The funding and money is best used in areas that need it. That need remediation rather than funding being used for areas that are meeting and exceeding standards already. I believe our focus should be targeted, investing resources where testing shows contamination. Otherwise, we're just asking responsible centers to divert funds from teacher salaries and child safety improvements to pay for filters that we don't need. The money is best spent in areas that really, truly need it. My final concern is the false sense of security that this bill creates. A filter is not a magic fix. It's temporary. It only works if it's properly maintained and replaced exactly on schedule. In a busy childcare center and a school of any size, it's a real risk. You have staff turnover, you have human error, you have simple oversight that can compromise a filter's effectiveness. The public sees a filter first sticker and assumes that the water is safe, but that filter could be past its lifespan. Meanwhile, the root cause, the aging lead service lines and outdated infrastructure, completely remains untouched. If we truly want safe water, we have to fix the pipes, not just the faucets, for those areas and those centers and schools that need it. There's a smarter, more sustainable path forward. First, target the funds where they're needed the most, the schools and the childcare facilities that actually test positive for the lead. Second, prioritize replacing lead pipes and service lines, not layering new mandates on top of already functioning ones. Third, allow for flexible compliance. Centers with clean, verifiable water should be able to opt out for periodic professional testing instead of permanent filter installations. And finally, let's integrate oversight into the system that already exists, like county health departments, which already monitor childcare every 2 years. We have great county health department in Saginaw County, and it keeps us accountable. Even all the way back from being a in-home childcare provider, we had to have our water tested in a well. Like, they came in, they would test your water, they gave you the results, and you couldn't move forward until it was compliant. I don't understand why having that in place under this system wouldn't be something that would make sense. I believe that we can do better. I believe that we can protect children's health without punishing responsible providers and the schools, and actually giving the funding and the help to the schools in the areas that they need it. I'd like to have you take time to consider this regulation. Maybe there's ideas that we can do to help tighten it up, to give the money and the funds, to give the focus to those that truly need it. One that restores public trust, supports small businesses, and also provides every Michigan child with genuinely safe water in all areas, including those with disparity. Thank you so much for your time and for your commitment to the children and the families of Michigan.
Thank you, Kimberly. Were you able to apply for one of the first filter grants?
I was not. From a child care standpoint, there were several different areas that you had to log into to be a part of, going on to my login business, from GEMS to EEM. Although we are a part of a lot of those, the application wasn't allowing us to get in because I was consistently denied by Eagle to be able to connect to their system. I had made multiple calls. That was one of the last systems that I was required to on the list to connect to. Now we have ISD preschools, so we have GSRP. So I already am connected to a lot of those different funding sources on my login and my login for business. So why I was unable to connect for hours and hours, I made multiple calls, it just didn't happen.
So how have you gone forward with implementation? Because you said you had to be compliant 4 days ago. How has that gone without the grant funding?
So without the grant funding, from a childcare perspective, putting it in place is easy. The area that I find interesting is that in a childcare setting, it is not required for the pitchers, like the water filter pitchers, to have to be tested. So we could have pitchers everywhere and regularly change like we do our filters, but those don't need to be tested. However, I did go ahead and submit my information to have my water tested, because I'd like to see like where are we at? You know, how does it come out? Although it was not necessarily required in our setting with the choices that we've been able to use, we'll see where it comes. I still have not gotten those results back, but I was also told 24 to 48 hours.
Have you heard from any of your colleagues in the area? Or have they had similar experiences? Is this a common theme in early childhood?
Yes, a lot of other providers are very frustrated, the majority of which are also using pitchers within their rooms. For my center specifically, though, I do also have, I do believe in water being able to be readily available to the kids at all times. So when I built in 2018, I have water fountains in every single one of my classrooms. So it was just an added thing that I put into effect automatically. And now they have a sticker over them that says, not safe to drink. And if you know kids, they're very, very literal. So when they're coming home from school or coming in after school and they're looking at all of these signs and they're just beginning to read, so like they're in kindergarten or, they see this not safe, what does that tell our kids? What does that tell our kids?
Oh, goodness. I'm sorry. That's just, it's frustrating. It's a waste. It's a waste of resources. I can just kind of anticipate this, future when we get the school supplies list that it includes a Brita filter for every kid to put in a can. Yeah. What things do you think could have been better on the early childhood side? To just, I think everyone's kind of expressed the same. Our facilities are all operating with water that we've been testing. We have it tested, and we know it's safe. And there are some folks that do need filters, but I'm looking back. I can remember a few years ago, it's probably more than a few now, schools try to get bonds, and sometimes while they're trying to get those bonds, maintenance can be deferred because they don't have a choice. And I remember local school district trying to get a bond, and there was a picture of the little kid bathtub sitting in the hallway collecting water from the roof. So do you think they're gonna, if money is tight, do you think they're gonna replace filters? Or are they going to try to fix the roof?
They're going to try and fix the room.
And so
they're on razor-thin budgets as it is. And so it's kind of interesting, even to send in the water. There's no checks and balances system whatsoever. Somebody could, make the choice to do things in a way that is, wrong. And I don't think that it offers the right options for us. I believe that it needs to be facilitated through a state system, similar to when you're an in-home childcare provider, and the schools could benefit from this. being able to have the oversight, say, from environmental health, like we did, where they come in, they test the water, you know, and it's done every couple of years. If for some reason something's wrong, then at that point, there's steps for change. But ultimately, if something is not wrong, why are we throwing money at something when that money needs to go into Metamora? You know, there was an example there. You know, I mean, that is money well spent when it can be able to clean up an area that really needs it. You know, with the Flint water crisis, this money can go to, how about, you know, the homes, the families, the children at home when they're there the majority of the time versus schools.
Are there any other questions? Okay. Thank you, Kimberly, for your time today. Really appreciate everyone taking the time to drive down to Lansing to participate through Zoom. I think, you know, from our perspective, it'll be really good to hear from the departments and kind of some feedback from them. There being no further business before the committee will stand adjourned.